Hi, I'm Macchi. I'm presenting on obesity's effects on COVID-19. So my research question is, does obesity have an effect on an individual with COVID-19? Obesity increases an individual's chance of getting heart disease, kidney diseases, high blood pressure, high blood sugar, and diabetes. When you get kidney diseases, a lot of the time the doctors will require you to get dialysis, and dialysis has an effect on your immune system, which would make you more susceptible to getting COVID-19. Having a weaker immune system would also lessen your chances of being able to fight COVID-19 as effectively. General consequences of obesity is obesity will increase a person's risk of death overall in general in a lot of different aspects. Obese people have higher levels of LDL cholesterol and lower levels of HDL cholesterol. They also have higher levels of triglycerides. Triglycerides and LDL are bad fats. This is what causes the risk of cardiovascular diseases to go up. There's also a connection between obesity and the rate at which you get type 2 diabetes. There's no actual cause that's been found for this, but there is enough evidence to show that your chances of getting type 2 diabetes go up when you are obese. So effects on the respiratory system in obese people. Like it says in this picture, you're more likely to get lung diseases. Your actual blood oxygen levels are significantly lower, as is your lung strength. This can be caused by different chemicals in your body, but not only that, obese people have extra fat and fat on your chest and neck area, which can cause respiratory distress because your lungs have to work harder to inflate. Also, your actual lung volume can decrease, which increases resistance in your airway. This also decreases your muscle strength in your lungs, making it harder for you to breathe and for your lungs to work the correct way. So evidence behind my research question and the connection between obesity and COVID-19 is described in this slide. So the study that I based a lot of my research off of was a study done in this September by Daniel D. Dressler. This took place in 9 different hospitals, and the study had been adjusted to take into account race, gender, and other genetic factors. Not only was the study done across 9 different hospitals, but it studied thousands of different patients. So the results concluded that obese individuals had 6 times the chance of intubation and death. As previously mentioned, this outcome could have arisen because of many different factors, including respiratory problems. But the study found that obesity has a clear effect on your chances of surviving COVID-19. Because COVID has clear effects on the human's respiratory system, this is why I made the connection between obesity and COVID-19, because obese people are more susceptible to having a lot of respiratory problems because of the things I mentioned in the past slides. So these suggestions are for obese people in general, but I think that it's especially important in this time because the virus will be around for a while, and there's talk of a vaccine, but it's still best to be safe. I would recommend regular exercise and trying to maintain a healthy weight. I referenced the DASH diet in this slide. This is recommended by a lot of doctors. So in this diet recommends that you eat a lot of whole grain and healthy fats, and you lower your sodium and sugar intake, as well as red meat. This focuses mainly on eating fruits and vegetables and low or fat-free dairy products. This diet wants you to eat less fat and oil, less sugar, as I said before, less alcohol, and eat more, as I said before, greens, fruits and veggies, lean protein, not a lot of fat, low fat dairy, and it also emphasizes the importance of getting nutrients from nuts, seeds, and legumes. Thank you for listening.